June 14th is celebrated as World Blood Donors Day. So, blood donation is considered one of the oldest type of donations in healthcare or in the medical world. So, it started even way before organ donation. Like people now donate liver, kidneys, heart, hopefully not brain, but all other organs. But blood donation is considered one of the oldest donations, and it's been going on for decades together. The first blood transfusion that ever happened, between a human and human was in 1818. Before this, physicians in the past had tried to give animal blood, like sheep's blood, sometimes dog's blood, to humans, but it had various side effects and was not well tolerated. Karl Landsteiner in 1900, so early 1900 to 1901, discovered that people have different groups in blood. So mainly blood groups like A, B, O and AB. And also that there can be positive or negative varieties of all these blood groups. For this discovery of his, he even won a Nobel Prize. And he is somebody who set the standards for blood transfusions early in the 1900s. So it's important on World Blood Donors Day to know a few facts about blood transfusion and blood donation. So who requires blood transfusion? Who are the people who require regular blood transfusions? Anybody who has a low hemoglobin. Usually the cutoff used by most people for blood transfusion is hemoglobin of 8 to 9. So if they have a sickness, patient is in the ICU, is requiring oxygen, or the patient has a cardiac disease, then usually the cutoff is around a hemoglobin of 9. And if none of these parameters, but patient has a low hemoglobin, then usually the cutoff we use is hemoglobin of 8 and below, for which we need to transfuse blood. Are all blood transfusions the same? Absolutely no. So there are different components in blood, like I've explained in my previous videos. Blood transfusion can happen as RBCs or red blood cells. So they are called packed red blood cells. They can happen as platelets, which are the cells that help you stop bleeding and also help you heal your wounds. They can also happen as plasma, which is not the cells but just the liquid part of the blood, which can be given in a frozen form. It's called fresh frozen plasma. People can also get transfusions of what we call granulocytes, which are the white blood cells, specifically the neutrophils that help you fight off infections. So these different types of blood or the different components of blood need to be separated at the time of collection. So 1 unit of blood is usually separated into red blood cells, plasma and platelets, and granulocytes only if it is required, because granulocytes last for only about a few hours, maybe about 4 to 6 hours. In very rare occasions, so previously blood transfusion is given as whole blood transfusions, which means blood was taken from a patient or from a donor and given as it is to the donor without really separating the components. But as time went by, we got to know that there are a lot of side effects to this whole blood transfusion. It can cause severe fevers, it can cause a lot of reactions, it can cause the patient to have a rash, sometimes drop their blood pressure, require oxygen, and various other complications. It can affect your lungs. So as science has progressed, we know that giving these components is much better, and the chance of side effects or risk of side effects is much lower. But even now, in current circumstances, we still use whole blood transfusions. Where is it? So in dire circumstances, like when there is a war and severe shortage of blood, whole blood can be given of the same blood group from one person to the other. If there is a massive blood loss due to a huge road traffic accident or trauma, it is difficult to replace each component, and whole blood transfusions can be given. At the same time, if there is a massive surgery that is happening with large amounts of blood loss anticipated, whole blood transfusion can be given in certain circumstances. Now that brings me to the question, who all can donate blood, because it's World Blood Donors Day. Any healthy individual about the age of 18 years with a normal hemoglobin, which is around 12 to 13 gram per deciliter, without any major medical condition, is a good candidate for blood donation. They can donate red blood cells, platelets, plasma and granulocytes. Now, who cannot donate blood? Children, so young children, teenagers under the age of 18 years, pregnant women, because they have a high requirement to maintain a normal hemoglobin, people with low hemoglobin or anemia. Usually anybody with hemoglobin less than 10, it's better to not donate blood or take blood from them, because they will of course drop their hemoglobin by a lot, and it's not advisable for them to do so. Anybody with abnormal counts, so people with low platelet counts, very high hemoglobin due to various medical conditions, should ideally not donate blood. And also people with very low blood pressure issues. So some patients have what we call hypotension, which may require medications. If it is under control and the patient is cleared by a physician, then they can proceed to donate blood. Otherwise, it's advised that they don't donate blood, because blood donation can itself drop the blood pressures by a certain amount. If you have any further questions about blood donation or blood transfusions, please feel free to reach out to me. I'm Dr. Neema Bhat, Senior Consultant Hematologist and Pediatric Oncologist. Thank you.